we're gonna tell you a little bit about what we found out. We we started talking after the swimming. So we used to have a cup of coffee and then work, but then we start talking, and what we made is this. And now we're gonna tell you what it is. Look, this is how the difference between the symptom, working with symptoms, and working how we work with behavioristic lifestyle change. And what it shows, there's a 1, 2, 3. 1 is environment, 2 is disease, a big disease, not symptoms as we used to work with, like cardiovascular symptoms, asthma, diabetes, which are not a disease. Actually, it's symptoms of one of the 2 diseases. CHVS, chronic hyperventilation syndrome, which is a breathing impairment, and the gut dysbiosis, which is a digestion impairment. What's happening? It's triggering the symptoms up there, from there. We have environmental stress, and we have mental stress, pollutional stress, nutritional stress, and physical stress. And they all are interdependent. So what is happening? According, well, HPA axis, that's what can trigger different kind of responses. And HPA itself, hypothalamus, pituitary, adrenal, and that's a stress response. So, and it can trigger, the first thing, it can trigger breathing symptoms or gut dysbiosis symptoms. And that's also interdependent, because when you get gut dysbiosis, your breathing is changing. When your breathing is changing, gut dysbiosis is going on, okay? And that's about energy acquisition. That's our Vitruvian man axe. Remember? Energy acquisition. Before we work with mental, physical, and immune, we have to optimize energy acquisition. That's what we're working, okay? And then the third grade, that's a systemic inflammation. Both digestion problems and breathing problems trigger systemic inflammation. And that's where our DNA, which is in blue here, it depends on our DNA. What is going to be triggered? Diabetes, asthma, or cardiovascular disease, which is systemic inflammation, all of them. And that's the first grade symptoms of disease, of these 2 diseases. But what the normal world is saying, this is disease. And we say, no, it's not a disease. It's a symptoms of the disease, lifestyle disease. And that's what... And the second grade symptoms, it's these small symptoms. We used to call it symptoms, but we call it second grade symptoms, because the first grade symptoms, it was the medicine called the disease. And we are with disease here. First grade symptoms here, and second grade, like asthma. What is symptoms? Breathlessness, stuffy nose, apnea, leg cramps, brain fog. And they're also interconnected. This is a bouquet of symptoms. And what is we all normally try to do? We try to cure. We try to cure the symptoms. We're starting from here. We have a remedy for stuffy nose. We have something for apnea, CPAP machine. We have some for stuffy nose. We have something for leg cramps. We have something for brain fog. That's wrong. We have to change the behavior. And the behavior we have to change. Otherwise, the genetics will do it for us. But there's something called epigenetics. You decide to change the behavior. Physical behavior, you change. Sedentary or not, you change. What the shit, to eat shit or to eat something good. You decide how to take in pollution into your life, environmental pollution. You decide the mental side. You decide how to experience all of this stress. So that's the behavioristic model. That's how to stop. And that's what we do. That's lifestyle change. Questions?